Gentlewoman from Massachusetts, Ms. PRESLEY, is recognized.
Thank you. Excuse me. Thank you, Madam Chair, and thank you to our esteemed witnesses for returning today. You know, since the beginning of the COVID-19 outbreak, we have seen not only the spreading of the virus, but also a rapid spreading of racism and xenophobia. We have witnessed at the highest levels, in fact, of the Republican Party fanning irresponsibly these flames. One colleague tweeted that everything you need to know about the Chinese coronavirus, unquote. My district is home to nearly 32% foreign-born residents, with more than a quarter immigrating from Asia. This painful rhetoric has consequences. Restaurants across Boston's Chinatown have seen up to an 80% drop in business. And I believe this has everything to do with the rapid spread of misinformation and paranoia. It is critical that we stand against these insightful messages and assuage fear in our communities. And we do that by dispelling untruths and misinformation. We can only do that by sharing the facts. And that is why I'm grateful to have you here today so that we can get to the truth about this virus. 30,000 residents across my district are uninsured and lack access to health insurance coverage. Many of these people are low-wage hourly workers, food service staff, nursing aides, hotel workers. A day off from work due to illness could mean losing a month's worth of groceries. The CDC's website advises people experiencing symptoms related to coronavirus to stay home and seek out medical care, but it doesn't really address the realities of living uninsured. Dr. Redfield, if I am a symptomatic hotel worker who is pre-diabetic, uninsured, and lacks the savings to cover the cost of testing and treatment, what specific guidance do you have for me?
Very important question. Obviously, we want you to be able to stay at home. And this, I think, I don't know exactly where it is, Tony, but I think there's clearly a great recognition of this issue by the White House Task Force. And I don't know where it is as far as it is, in getting its way to you. But I can tell you we've addressed this as a critical public health component. We need these individuals to be able to do their 14 days at home and not have to sneak out for an hourly job because they have to pay for their cost of living. So I can tell you that the White House Task Force is addressing this. Tony, you want to add anything?
Well, Dr. Redfield, if I might, will the cost of testing be covered?
The cost of testing will be covered.
And what about treatment?
Cost of treatment will be covered.
Okay. And so, and I appreciate that these conversations are happening. In terms of information that is public-facing and accessible to the general public, as of this hearing, neither the CDC's portal for the coronavirus or its FAQ, frequently asked questions page, has information about what the tests cost, who will cover it, and whether uninsured people can be tested. And so this has contributed to the confusion and the panic. So can you please make a commitment today to add this information to the website?
We will do our best to clarify. Related to costs, particularly for LabCorp and Quest, they haven't really defined it, but they have shown their leadership in rolling it out independent of that. But I will get as much information as I can on that website and keep it updated.
So I can take that as an affirmative, a yes.